Welcome back to Jersey Matters. I'm Larry Mendte. We're going to take a break from election coverage for a second to check in on COVID-19 research, because a lot of that research is happening in New Jersey at Rutgers University. So let's check in once again with Dr. Reynold Panettieri, who is the Vice Chancellor of Translational Medicine and Science at Rutgers. Doctor, we always appreciate your time, and we'd like to check in with you every couple of weeks to find out what's new. Let's start, if we could, with the vaccine trials. There was some talk that we may have a vaccine for emergency use by October. That didn't happen.
Yeah, that's not happening. I think the vaccine trials are on target to read out probably end of December. With the potential of knowing efficacy and safety by January. That is still far, far faster than anybody could have imagined. If you think about it, Larry, it was only February where we were really starting with the pandemic, and to develop a vaccine this quickly is phenomenal. The ones in play in New Jersey are really the Moderna trial and the Janssen J&J trial. The Moderna trial was out in front a little faster, and they're closing their enrollment, so their readout's going to be probably measured in weeks. The J&J vaccine, which is a very prominent vaccine, we were trials for both of these at Rutgers, by the way. That one is actively recruiting in the New Brunswick area, with hopefully final recruitment in November, and then readout shortly after that. So, globally, AstraZeneca's their vaccine is out in front, and we just heard that Rutgers will be a site for the Sanofi trial in Newark. So these are lots happening in New Jersey. It's a whirlwind, and we're right in the center of providing the participants and hopefully the documentation necessary to get approval.
No, it's been impressive to what Rutgers has been involved in. I understand that you just received a pretty big grant, and you're one of the principals on that. So congratulations.
Thank you.
On getting more testing in the minority community.
Yeah, well, New Jersey is the one of the most densely populated and diverse states in the union. And we competed very aggressively. We were one of 10 nationwide to be awarded a grant. That's going to really be a unique way of testing vulnerable populations for COVID-19. And what we're using is our healthcare worker cohort, which is 6,000 strong, Larry, as ambassadors to go to the community, to recruit, hopefully to gather people around them to get tested, not only in their immediate family, but their extended family. We are also partnering with the Parker nursing home facilities, as well as VNA of New Jersey. So we hopefully will have new ambassadors who are going to go to vulnerable populations and hopefully encourage the testing of individuals. The primary outcome of this is enhanced testing. If we know if people are infected, we can then quarantine and prevent transmission.
Are we in a second wave right now?
No doubt about it. In August, we were at an R value, which is a transmission rate of less than 1, which is very, very good. To give you an idea, back in February, we were at 3, which was sort of redlined. Right now, we went from like 0.9 in August when everyone was out and it was summer, to 1.26. So what we're seeing now is an increased incidence of infectivity. We're seeing greater ER visits, greater hospitalizations, and unfortunately, more ICU admissions. It was a month ago, interestingly enough, that at University Hospital in Newark, there were only 2 people in the hospital with COVID. Wow. 2. And, now we're seeing hundreds. So, I think the second wave is here. We hope It isn't going to be prolonged. And we've had seen less severity of illness. So whereas all the ventilators were used in the ICU beds in February, March, we only see the rare patient having to go to the ICU. So we're starting to see some improvement in therapeutics for this devastating disease.
Just to wrap this up, we're in the middle of a campaign that has gotten ugly at times. And one of the things that has been infused with politics is science and the treatment of COVID-19. And it's created mistrust, and it's created two camps. One that want a lockdown, one against the lockdown, one that want masks, one against masks. And so some simple basic things, even the use of a vaccine has been questioned, or the validity of vaccines has been questioned. Does that concern you?
Well, it does. It's always concerning when we make decisions without all the facts, Larry. Science has a method, and that method needs to be vetted, and it has to go through evidence to get to an end. We live in a world where we want information immediately, and we can use our phones. We can get information like we've never had it before. Unfortunately, we can't get information as to how are we going to stop this by using current approaches. We have to discover, we have to do research, and that research has to be valid and reliably tested. Everyone wants to be first at the block or first out of the block, right, with the answer. And I think people pull the trigger way too fast without considering the process.
Well, we're all waiting, and I hope your timeline's correct. Thank you, Doctor, as always. I appreciate your time.
It's my pleasure. Have a great day and be safe, Larry. Thank you.
That was Dr. Reynold Panettieri, who is the Vice Chancellor of Translational Medicine and Science at Rutgers University. When we come right back, we'll get back to the 2020 election and speak to one of the most powerful political figures in New Jersey over the last 30 years, former State Senator Joe Kyrillos. That's when Jersey Matters comes right back.